Hi viewers, now we are continuing the male infertility. Now we are going to study the thing that is post-testicular problem. We already studied in the previous video testicular and pre-testicular. Now we are discussing the post-testicular problem. See, post-testicular problem, the block can appear or occur in vas deferens or epidermis. The block can be appear in the vas deferens or epidermis, and that which are the condition that leads to male infertility in the post-testicular region means that is congenital bilateral vas deferens absent. The congenitally the vas deferens absence means that also leads to the infertility in the male. And the next thing we have to know, that is the inguinal hernia. Why I am writing here inguinal hernia without any relation? Sure, there is a relation. You all know the hernia had no medical treatment, only surgery treatment. That is, we are using the mesh work college. Don't forget, hernia don't have medical therapy, only the surgical. So hernia we are using mesh work. While doing the hernia surgery, there is a chance to block the vas deferens. That is the iatrogenic. We are calling the medical term iatrogenic. That is a medical error. So while doing the inguinal hernia, the surgery can make mistakes, or it can be blocked in the vas deferens. That also can cause the block in the vas deferens. The next thing is Carter syndrome. The next thing is Carter syndrome. Carter syndrome's also the problem in the post-testicular. This is the primary ciliary dyskinesia. Dyskinesia, one of the condition, it will cause post-testicular problem. Here sperm production, but pre-testicular, testicular, there is no sperm production. So what about the FSH level? Here testis utilizing the FSH and the pituitary hypothalamus secreting FSH. So everything is normal, but the sperm can't come out from the body. So FSH is, what FSH? Yes, FSH is normal. FSH is normal. So this is the post-testicular. So we already know pre-testicular, post-testicular and testicular. Now we will come. See, now the diagnosis. I am using by the FSH value, I can find out where the problem. So FSH test. So if the FSH will increase, the problem in the where? Testicular problem. If the FSH will decrease to pre-testicular problem. If the FSH will normal, that is the post-testicular problem. So while seeing the FSH value, you can find out where the problem can appear. The next thing is Porter archidometer. Porter archidometer is the thing. This is to measure the normal testicular volume. Helps to measure the testicular volume. Normal testicular volume 18 milliliter. So this Porter archidometer helps us to know the size, shape, volume, everything. It helps to know. It helps to find the shape, size and volume. Which one is Porter archidometer? So FSH value also helps us to find the male infertility problem, and Porter archidometer also will help us. And the next thing, there is one question, very important question. we already know the most common cause of male infertility, that is iatrogenic. And the next thing, the most common surgically correctable condition that disappear the infertility, which thing is varicocele. If the patient have varicocele, if we have operate it, and then the infertility problem will disappear. The male now after finishing the surgery, the male become unfertile. That's the condition. So don't forget, this is also a very important question. Most common surgical process, most common after surgical causes that disappear the male infertility, that is varicocele. That's the very important process. Now we are going to the treatment. See, treatment, if the patient or the smoker means, we have to tell to the patient to stop smoking, even alcohol too. Smoking is the main risk. Smoking, if the patient is obese, stop smoking. Obese means to reduce the weight. And that at the same time, in the iatrogenic condition, we can give the anti lot of oxidant and the multivitamins. When the idiopathic, without reason, we can give lot of oxidant and multivitamins. The oxidant by and vitamin E we can use. The next thing, at the same time, we can use the treatment like a HMG. We already studied in the previous video, human menopausal gonadotropins. And then we can use CC. What is CC? Clomiphene citrate. That is the treatment of the PCOS. Here also we can use. So this all the things comes under the male infertility. We have to do the count, mobile, and then morphology, and we have to find out the problem where it can appear, testicular, pre-testicular and post-testicular, and how we can find the diagnosis and what should we do. Is all the male infertility. Hope you like this video. If you like this video, do like, comment and share, and don't forget to subscribe my channel. Thank you.